Okay. Hi, everyone. Welcome to this webinar on the Yemen humanitarian crisis. I'm really excited to be joined today with Aisha Jumaan, who's the founder and president of the Yemen Relief and Reconstruction Foundation. It's a nonprofit charity organization that provides relief to the people of Yemen and to support peace-building efforts in Yemen. Aisha is a public health professional who worked with multiple organizations, including the CDC, Emory University, international health agencies in Yemen. And currently she's an independent consultant managing health-related projects in Yemen. And we're very excited to have you with us, and thank you so much. And if folks have questions, please put them in the chat. We'll have time at the end for questions. Take it away, Aisha. Thank you.
Thank you very much for inviting me. I'm honored to be with you guys. So I'm going to start. This is the map of Yemen. And I just want to show here why Yemen is strategically important to the rest of the world. Yemen controls what is called Bab el-Mandeb, and that's where most of the oil that comes from the Gulf countries passes through to the rest of the world. So unfortunately, the value of a country is dependent on money. So some basic facts about Yemen. The population ranges between 29 to 30 million people. Area, since I live in Washington State, is about 3 times that of Washington State. First recorded settlement in Yemen is about 5,000 BC, and Mocha, or Al-Mocha, is the Yemen port where was once the World Coffee Trade Center. So when you drink coffee and it says Mocha, that's the port that used to export coffee from Yemen. I also want to start with something positive because the rest of my presentations is not. So this is Sana'a, where I grew up. Sana'a is a UNESCO World Heritage Site. It is the oldest continuously inhabited city in the world. These are some Yemeni architecture depending on where people live. So if you're in a desert, like the picture with the big rock with homes on it, or in the mountains, people build their homes based on what is available in the environment, but they also are very environmentally conscious, and they build the homes to taking into consideration where the sun shines, where it sets, and the wind directions. So they've always been very environmentally conscious. These are some of the terraces of Yemen. A lot of people don't realize that Yemen is actually green. They think it's like the rest of the Arabian Peninsula desert. It's actually not. Yemeni built the first terraces also in the world. And the highest mountain is actually in the Middle East is actually in Yemen. A lot of people think maybe it's in Lebanon. It's not. And now I'll go into the impact of the Saudi war on Yemen. I'll start with the coalition airstrikes, and then I'll go into the blockade. This shows airstrikes targeting civilian infrastructure in Yemen, 2015 to 2018. And if you look at the numbers, residential areas constitute about 2,000 homes that had been bombed. Transportation is infrastructure, 772 mosques of all places, 51 historic sites, 46. The largest museum in Yemen was destroyed, and one of the pieces, or the youngest pieces in that museum, was 3,000 years old. These are some of the places that had been bombed, including homes. The one with the big bomb, that's actually the area where I grew up in and where my family home is. I just want to show data from September 2019 to the previous years. The US government continues to say that it's aiding the Saudis with targeting, and that without the US support in targeting, the Saudis will make mistakes and target civilians. That actually has not happened. So as of September of this year, you can see that only 22 of the airstrikes hit military bases, while the majority of them hit homes and other civilian infrastructures. These are, again, this is Sana'a Airport. Sana'a Airport has been closed by the coalition for commercial flights since August 2016. So that means when I need to go to Yemen, it takes me 4 days to get to Yemen. Okay, so what I convert into that. This is a recent report that just came out, and it says here that death toll from Yemen's war hit 100,000 since 2015. This is 10 times the number that had been circulated in the media for a long time in UN reports, which was 10,000. This is, by the way, only due to airstrikes. This is not due to other causes of the war in Yemen. So the majority of the airstrikes caused 2/3 of the civilian casualties. So the majority of the airstrikes target civilians. This shows the deadliest Saudi coalition bombing in Yemen targeting civilians between 2015 and 2018. And the reason I have this slide is to show that there is no improvement whatsoever from 2015 to 2019, where the Saudis continuously target civilians. These are some hospitals that had been targeted in Yemen. Unfortunately, they can't fix all of them. So what they do is that they just clean them and resume their work. So about 50% of the Yemeni health centers and health facilities have been bombed. This is Saudi-led coalition admits to bombing a funeral home in Yemen. This was where people, a prominent person in Yemen had died, and many people attended the funeral. Over 100 people, 140 people died. And they did what is called a double tap. So they would do the first airstrikes, and then when first responders go to help, then they do the second airstrike. This is the deadliest Saudi coalition bombing children. And as you can see, there were 40 plus children that died in the Hyan market. And this was a school bus. Children were going on a field trip, and they targeted the school bus, killing over 40 kids. The majority of these were actually less than 10 years of age. And again, if you look at the dates, they've hit market, they've hit weddings, they've hit everything that, where civilians, it's very clear that it's civilians. So if we look at 38 children among 80 dead in 24 September, wedding ceremony in Mukhatahez, and the last one, 48 children among 97 injured, and 11 children were amongst 21 dead in April 2018 in another wedding in Hajjah. And I also have the references for all of this information. I use my information from the UN, US, and UK media, first of all, because these are all English. And the second reason is because the US and the UK are partner to the Saudi war on Yemen. This is from the New York Times on the school bus. Saudi coalition airstrikes hit school bus in Yemen. Unfortunately, when this happened, the US government or Secretary Pompeo was supposed to give a briefing to Congress about the Saudis abiding by international law governing wars. And immediately, the day after they hit the school bus, Pompeo certified that the Saudis are not breaking international laws. This is the mass funeral in Yemen for the children killed in the Saudi-led coalition airstrikes. This is, again, deadliest bombing of civilians in April 2019, again, to show that over time, there is no improvement in targeting. And this is the number one reason the US continues to support, at least that's what they say, the Saudis, is that they're improving their targeting, and that without them, they would be targeting civilians. I'm not sure that argument is actually accurate. And this is in September 2019. So 5 air raids left 25 civilians dead in September. And then it goes on each day in September where civilians were targeted by the Saudis. So you have 24 September, 4 women and 5 children dead. 23 September, 7 civilians dead, and 22 September, again, 2 civilians dead. And until now, the pattern is the same from day one. UN says civilian targeted in airstrikes on Yemen capital. This is again in May 2019. This is from geopolitical alerts. It's actually very scary because it says over 52,000 attacks total, 50 airstrikes per day on average in Yemen. So imagine living in that environment where there are at least 50 airstrikes on you. I was in Yemen this summer, June and July, and the first night I got into Sana'a, there were quite a few airstrikes very close to where my parents live. And the last night also, the same thing happened. There isn't really anything you can do because they hit homes. All you can do is pray. And the only thing I had in mind when they were doing that is to pray that if there is an airstrike, that I actually die and not survive it, because I didn't want to have to deal with the aftermath of being hit by a bomb. The other thing is, and I didn't realize how much it affected me until I was here in Seattle. And last month, there was thunders in Seattle, which is not very often that we have thunders. And I woke up thinking that I was in Yemen and the next strike was going to be on me. This is again in September of this year, Yemen, scene of devastation as every single detainee either killed or injured in an attack. So this was prisoner of war facility that they bombed. And unfortunately, those who were in this prison were actually fighting alongside the Saudis. This is from the UN. These are very dark times for Yemen, scenario and official on airstrike, mass casualties. Nowhere is safe to hide in war-torn Yemen, says UN appointed right experts, which is absolutely true. And I can, testify to that based on my visits to Yemen. I go every year. So if we look at the impact of the war and the blockade on the humanitarian crisis, this is from Human Rights Watch in Germany, October 2016. And he was right on. And 2016, not many people were saying what Wenzel said. He said, Saudi-led coalition is committing many apparent violations of the laws of war, indiscriminate attack on civilians, use of internationally banned cluster munitions, and guess where they get them from? The coalition imposed blockade may amount to starvation of civilians as a method of warfare or crime. This was in 2015, and that blockade still exists today. So if we look at the number of people in need, 2014 to 2019, we see about 24 million in 2019 who are in need of some humanitarian assistance. This is out of 13 million. So basically, the majority of the Yemeni population are in need of some assistance, and this is more of a doubling in the number of those who need help. If we look for the basic survival needs, more than 20 million people across the country are food insecure. This is a man-made famine. This is not due to natural causes. 10 million of those are suffering extreme level of hungers. Estimated 7.4 million people require service to treat malnutrition. 3.2 million of those require treatment for acute malnutrition, which means emergency. A total of 18 million people lack access to safe water and sanitation, and 19.7 million people lack access to adequate healthcare. These are, by the way, from WHO, and I forgot to put in the reference, but I have the reference for that. Again, this is from WHO, protection of civilians. Tens of thousands of people have been killed or injured since 2015. And at least 17,000 civilians, as verified by the UN, which is really very interesting because the number is a lot larger than that. An estimated 3.3 million people in Yemen remain displaced. In terms of livelihood and essential services, economy has contracted by about 50%. Employment and income opportunities have significantly diminished. Of course, if you have a blockade and you're not able to bring in what you need for your business, that happens. They also moved the central bank from Sana'a, and as such, people have not been paid their salaries since August 2016, and that is civil servants. Exchange rate volatility, unfortunately, depreciation of the Yemeni riyals, basic services and institutions that provide them are collapsing. A lot of the hospitals don't have any of the machines that they need to do the work or the medicine that they need to do the work. And I focus a lot on health because that's what I actually do. Only 51% of the health facilities are fully functional. And this is an improvement from last year where only 40% were functional. And this is due to international aid. Yemen death toll to surpass 23,000 by the end of 2019, UN report. This is not due to the fighting, but due to diseases and hunger. And then it talks about how many person years Yemenis would be losing. And this is the website, a reference for that. So why is Yemen the world's worst humanitarian crisis? This is from the Norwegian Refugee Council. And I'll go over this real fast. One is that half of the children are dying from acute malnutrition. We have the largest food insecurity in the world. We have the largest outbreak of cholera in the world with over 2 million cases now. We have an indiscriminate airstrikes that amount to war crimes. And then it talks about the indiscriminate airstrike example of the kids on the school bus. And then another one in Hajjah. And they've actually had a lot of airstrikes on wedding. And the reason they do that is they think one of the Houthi leaders is attending that wedding. So they don't mind targeting the wedding if they think a Houthi is present. This is from 2017 from the Norwegian director. And he said something that he said, "I'm shocked to my bones by what I have seen and heard here in war and hunger-stricken Yemen." He visited Yemen in April 2017. He said, "The world is letting some 7 million men, women, and children slowly but surely be engulfed by unprecedented famine." And again, he's saying this preventable catastrophe is man-made from A to Z. This was 7 million was in May 2017. Today, we are at 24 million. Alex de Waal, in his book called Mass Starvation, The History and Future of Famine, says Yemen is the greatest famine atrocity of our lifetime. The Saudis are deliberately destroying the country's food-producing infrastructure. The US and the European countries have enough leverage to get the Saudi and the Emirati to stop bombing agriculture, health, and markets infrastructure and open the ports. It's a political created famine, and it will have to be solved by political created means. And this is from, I think, the New York Times or the Washington Post. It says, Saudi tried to starve Yemeni into submission. This is bombed into famine, how Saudi air campaigns target Yemen's food supplies. So this is purposeful inducing famine in Yemen. Coalition airstrikes and factories heighten crisis in Yemen. Every single factory in Yemen was bombed. This sheep after an airstrike. All chicken farms had been bombed. My parents, who owned 2 of the largest chicken hatcheries, both were bombed in 2017. Targeting cattle farms and also targeting fishermen. So Hodeidah, which is where the majority of the people need to fish for their food intake. Unfortunately, every time fishermen go out, they get targeted. And so Hodeidah now is the worst in terms of malnutrition and food insecurity in Yemen. And this is from the New York Times. In Saudi Arabia, war in Yemen, no refuge on land or sea. This is from MSF also saying that they've treated 5 fishermen after a military attack on their boat. They've treated 76 in this hospital, and this is in February 2019. So Al Hodeidah port is the largest port in Yemen. That's where about 90% of the Yemeni products come in that serves about 70% of the population. During the Obama administration, it was the international community, including the US government, have made Hodeidah port a red line, meaning they cannot bomb Hodeidah. Unfortunately, that changed, and the Saudi and the Emiratis decided that they are going to bomb Hodeidah. When they started bombing Hodeidah, that means no more aid can come through the Hodeidah port, which serves the majority of the population. 8 groups in Yemen warned attack could endanger all supplies. And the Hodeidah port now is non-functional. Attack on Hodeidah and the US role, the coalition had shown no respect for the laws of armed conflict, and they intensified their targeting of Hodeidah, unfortunately, and that was in June of 2017. Americans are also at risk of complicity in the crimes committed by the coalition forces in Yemen. And the UN Security Council demanded a halt to the Hodeidah attack with no results. Saudi-led coalition conduct airstrikes on Yemen Hodeidah. They should say port, it's not the airport. Airstrikes on cholera and hunger. Yemen's cholera outbreak now is over 2 million cases with over 3,000 deaths. Diphtheria outbreak. Yemen has not had a diphtheria outbreak since 1980. Unfortunately, it's extremely infectious and also is fatal. Aid agencies have had to divert resources from food programs addressing the hunger crisis to tackle disease outbreaks. Saudi-led coalition air raids have repeatedly targeted infrastructure, healthcare, food, and water science. This just shows the number of children who are malnourished and also number of women who are malnourished. And the numbers just are staggering. There are about 5 million children are in need and about 2.4 million women. This shows the food imports via the Red Sea ports and share of required met. If you look at the national food requirement, which is the gray line, so this year is actually better than previous years. In the previous years, what was allowed was about 20% of what Yemen needs, because there was a lot of pressure on the Saudis. They've, allowed more to come in. So there, as you can see, there is fluctuation, but it is improving over previous years. However, if we look at the prices for food baskets in Yemen, and if you look again at the gray line, that was what the prices were, and the green line is what the prices are today. And again, it depends on what's available in the market, making it very difficult for families to afford it. This is access to water. So people who need clean water and sanitation, there's about 18 million people, and acute need about 12 million people. I mean, I just can't think of all these numbers. 55% of men, women, and have access to an improved, don't have access to water. 1 in every 2 people who are internally displaced don't have access to water. 45% of the households in homes says that they don't have soap at home, and 75% of those say because they don't have funds to buy soap. So if we look at the other commodity that is very important for health services, and that is fuel. And again, we see the gray line is what they need to import, and the red line is what actually is allowed into the country. And you can see it ranges from 21% in January to the largest 51% in June. And then in September, it fell again. And in October, they actually prevented any fuel from getting into the country, forcing many of the health facilities to close. And the largest hospital in Sana'a was forced to close. And this is, again, from the Norwegian Refugee Council, saying new fuel crisis deepens suffering for hungry Yemenis. So if we look at the impact on the health sector, the blockade imposed is on sea, land, and air, is hammering access to food and medicine. The Saudi coalitions imposes long delays on medicine that gets into the country, leading to expiration of medicine. There are 132 drug categories for chronic diseases, including cancer, are no longer available in the public sector. And and private companies have to increase their prices threefold because it takes a long time to get medicine into the country. More than 50% of the health facilities have ceased to provide services. This is from German DW. It says Saudi airstrikes in Yemen hit facilities providing water to hundreds of thousands facing cholera epidemic in Yemen. This is from ICRC. Border closure shuts down water sewage system, raising cholera risk. This is in 2017. And now we are in 2019 with over 2 million cholera cases in Yemen. And this is, if you compare the cholera cases in Yemen to Haiti, Haiti had 800,000 cases, and it was a huge deal, and everybody was trying to address the cholera outbreak in Haiti. We have now 2 million cases of cholera in Yemen, and somebody was asking me the other day, why is Yemen not getting the attention it needs? This is the largest cholera outbreak in recent history. And why is at least not, the scientific community and the health community is doing that? And my hypothesis for that is a lot of US universities receive money from the Saudis and the Emiratis, and they're very, very careful into what they say publicly. I remember speaking to someone whose university is not receiving funds from the Saudis, but were aspiring to receive funds from the Saudis. And the president told them not to attack the Saudis in any way, just for aspiring to get funds. Unfortunately, now we also have dengue outbreak in Yemen. It's one of the worst we've seen. There was an emergency an announcement today that Hodeidah is experiencing the largest dengue outbreak that we have seen. It also is manifesting in hemorrhagic fever, which means that we're going to see a lot of deaths, unfortunately. Cancer patients in Yemen face slow death as treatment option diminishes. This is from 2017 from WHO. Same thing in 2019. Yemen cancer patients suffer as clinics are closing because treatment is not there. We were able to deliver some medicine that was donated to Yemen Relief by AmeriCare. It took a very long time to be able to get it to Yemen, and when it got to the port, the Emiratis would not allow the trucks to get in for a very long time, over 2 months. And by the time we were able to get them out, there were a lot of other issues. And when I asked why that is the case, I was told very, honestly, that there were 2 reasons for that. One is political, and that is to make the population suffer, because the idea is if the population suffers, it's going to rise against the Houthis, and it actually had the opposite effect. The second one is the Aden port, where that is now available to get things into Yemen, is small and cannot handle the large shipments that are getting into the port. Hidden cost of war in Yemen, kidney patients die. Hospitals in Yemen are unable to cope with swine flu. Another thing that people don't talk about, when the MSF hospital in Afghanistan was hit by mistake by the US, there was a huge outrage, and the US had to investigate it. There are 6 MSF hospitals that were hit by Saudi airstrikes in Yemen. Not a single one was investigated. Oh, the last one, by the way, was last week. This is their cholera center. On June 11, 2018, they had just built a cholera center in Hodeidah, and that the day they were going to open it, they had sent the coordinates several times to the Saudi because that was going to be opening day. And guess what? They attacked it on the opening day. So impact of the war and blockade on children in Yemen. A lot of children have died in their homes. This is Zainab. I know the father here on 16th of Ramadan, July 3rd, Ibrahim's home was hit and his 1-year-old daughter, Zainab, was killed. Impact on children. And so this is from UNICEF. It says, in Yemen, a child dies every 10 minutes from preventable causes. New York Times, 85,000 children in Yemen may have died due to starvation. Too Weak to Cry, Save the Children was 5 million children at risk of famine in Yemen. When my husband went to North Korea at one point in time when they had famine and he went and visited wards, he came home, was extremely distraught. And he said the hardest part for him was when he was getting into wards and not a single voice was coming out of these wards because these kids were too malnourished to even cry. Again, it's a slow death, the world worst humanitarian crisis, the tragedy of Saudi Arabia's war in Yemen. This is Amal Hussein. Amal was 7, was wasting away from hunger. The Saudi war in Yemen had pushed millions to the brink of starvation. This is Amal Hussein when she was 4. She was featured by UNICEF. And her father had bought her gold earrings and for Eid, and she asked him if she could wear them before Eid. The father said, asked that she wait, and she said, I don't know if I'm going to survive until Eid, when she was 4. Why would a girl who is 4 think that she may not survive until Eid? And it's because a lot of her friends had been bombed in their homes. Unfortunately, 3 years later, her father couldn't even buy her food. Amal died a day after that article was published. Half of the kids in Yemen under 5 have stunted growth, UN says. Yemen is a living hell for children. This is from the UNICEF regional director. Not for 50% of the children, for 100% of the children. And according to him, there isn't just one Amal, there are many thousands of Amals. The issue with malnutrition, I would like to focus on the last 2 points, is that chronic malnutrition is crucial for child brain development. And 50% of the many children under 5 are going to be chronically malnourished, which will not develop to their full intellectual potential. So the impact for this, we're going to have to live with it in Yemen for many, many years to come. So in terms of accountability, you are naming children. 3 times the Saudi made it to the list, and the US, thankfully, pressured the UN to remove the Saudi out of the list. This is a school that was bombed. Yemen collective failure, collective responsibility. This is from the UN experts, and these are some of the main findings. Saudi UAE airstrikes, this is from 2019, by the way, continue consistent, significant patterns of civilian harm. US arms transferred to Saudi Arabia, UAE of questionable legality. US may be held responsible for aiding the Saudi and the UAE war crimes in Yemen. And this was developed by a friend of mine. US, this is Frontline, and this was October 1, 2019. US weapons, Saudi airstrikes, Yemeni deaths. What a UN report on war crimes in Yemen means for US Saudi weapons sales. UN report says US, Britain, France may be complacent in potential war crimes in Yemen. So what the Saudi, this is again, Saudi strikes, American bombs, Yemeni sovereign, how Saudi Arabia war tactics have fueled Yemen humanitarian crisis. US Saudi Arabia seal weapons deal worth nearly 110 billion, immediately 350 billion over 10 years. And President Trump had been very clear that as long as the Saudis are paying for arms and for services, he's going to continue to support them. Why should we be concerned? The Leahy says no assistance shall be furnished to any unit of the security forces of a foreign country if the Secretary of State has a credible information that such unit has committed gross violation of human rights. And as I said earlier, unfortunately, Secretary Pompeo certified that the Saudis were not committing war crimes the day after they bombed a school bus full of children. how lobbying firms helped destroy Yemen. This is from The Nation. Saudi Arabia and the United States are probably guilty of war crimes in Yemen. This is from National Security Journal at Harvard Law School, and they looked at Yemen and the Saudi role, the US Saudi-led coalition violating international humanitarian law and the US role. This is basically the main finding: killing hundreds of civilians through airstrikes, contributing to a humanitarian disaster by imposing a blockade. US has provided invaluable support to Saudi campaign, weapon sales, mid-air refueling, although that is no longer happening, targeting assistance, training, and logistical support. The article finds that continued US support for the Saudi in Yemen may violate several domestic and international laws. Stop the unconstitutional war in Yemen. This is what our Yemen policy looks like. US role in the Saudi coalition on Yemen. This is something from Robert Malley. I was actually heartbroken when I read this article. He basically says that they never discussed in the White House during the Obama administration whether they should or should not support the Saudis. They were so concerned about the Iran deal that they were willing to do anything to support the Saudis, so the Saudi would support the Iran deal that no longer exists. So what can we do? Advocacy. I think we need to do everything we can to advocate for Yemen and support relief agencies. This month, APHA resolution, we submitted an APHA resolution to American Public Health Association, a call to end the bombing and end the blockade on Yemen. And the resolution, this is what the resolution proposed is US Congress should continue its efforts to employ the Waal Power Act to end our financing and of military collaboration with the warring parties. All parties attempting to enforce a blockade on Yemen should immediately lift the barriers for entry for the humanitarian support, and robust UN efforts should be undertaken to provide immediate relief and reconstruction, especially health, education, transport, and so forth. This, luckily for us, was passed and adopted by APHA this month. The vote for it was 149 and against it were 21. And this was just during the meeting in Philadelphia. I'll talk a little bit our Yemen relief work in Yemen. So we provide food baskets, we provide medicine for cancer patients. This is a kid with cancer who we gave her a coupon to go and buy Eid clothing for the celebration. We also provide clean water through water filters. Not easy to get them to Yemen, but we really are persistent. This is Aslam, an area that's borders Saudi Arabia. Not many people were able to get in there, and people resorted to eating leaves. There were a lot of articles on that. Luckily for us, we managed through our contacts in Yemen to gain access and provide food supplies to families, and especially families with kids who are malnourished. This is cancer medicine that we distributed to 5 cancer centers. This is, again, the medicine in different cancer centers. We also provide school bags. Last month, we distributed school bags and school supplies to 2,288 children. This picture is from 2017. And again, clean water, especially dealing with cholera. I also want to say a little bit about the resiliency of the people of Yemen. These are some of the places that the healthcare workers have to travel to. They get to a point where the car cannot go any further. And I've actually been in these roads and provided these services, where then we use donkeys to gain access to most of the villages. And we do the same thing with our aid as well. And this is just to show how the homes, how sparse they are, and the healthcare workers walking to provide services to those places. And thank you. And I'm open for questions.
Thank you so much, Aisha. It's truly devastating, but incredible to have you share this with us. We do have one question in the chat from Alice. And if folks have other questions, please put them in the chat. The question is if you could give us a quick background as to why Saudi Arabia is bombing Yemen and what their goal, I guess, is.
Yeah, I focus on the humanitarian aspects. First of all, regardless of why they are at war in Yemen, they shouldn't be doing what they're period, because they are violating every law that governs war. I don't think the Saudi themselves know why they are bombing Yemen. I think I would go with what the German intelligence have said in 2015. The German intelligence, which not many people know that it's German intelligence, they published a report and they said that Mohammed bin Salman, who's a crown prince now, was a destabilizing figure in the Middle East, and that he went into war in Yemen to become a national hero and become second in line to be the king after his father's death. I actually believe that German intelligence would not publish something like this unless they were really serious about it. Of course, the Saudis accepted, and Merkel had to apologize. That's what I think why he wanted to go to war. He was the Minister of Defense at that point in time. He was young. His cousin was second in line. He wasn't second in line. And but the stated goals, and they changed, by the way. One is that they want to reinstate the government, internationally recognized government of Yemen, back to Yemen. Although that hasn't happened, they prevented the president from going back to Yemen, and he's actually, in my mind, is hostage in Riyadh. And the other one is they are afraid that the Houthis are allied with Iran, and they don't want another alliances that is south of their border to be allied with Iran, because they are saying they don't want another Hezbollah. So the big difference between Hezbollah and the Houthis, first of all, is that the Houthis are not Shia, although everybody calls them that. They are Zaydis, and Zaydis are closer to Sunni than they are to the Shia that exist in Lebanon, for example. Unfortunately, because of what's happening, the alliance between the Houthis and Iran has strengthened. If we look at the history of the relationship between the Houthi and Iran, at one point in time, Iran gave them funding when they were fighting with the Yemeni government, and they returned it because they did not want to have any money from Iran, because they disagreed with them in theology, actually. So those were some of the stated goals by the Saudis. But I believe the German intelligence that Mohammed bin Salman thought, and he did go on, on national TV and in the Arab League saying this is will take 2 weeks to 2 months maximum, which is also what they told the Obama administration. What people don't get is it's easy to decide when you get into war, but it's very difficult to decide when it's going to end. And now we're 5 years down the road.
Yeah. Thank you. There's another question here from Ron Bloom. It was hoped that the Khashoggi murder would put pressure on Saudi Arabia to rehabilitate their image, de-escalate, and do you see any impact of that happening?
Yeah, there was a quote that says, killing millions is statistics and killing one person is a tragedy. And that's exactly what happened. So a lot of the attention on the Saudi did not happen because of their atrocities in Yemen, but actually because of the Khashoggi's killing. And that is accurate. It has, brought a lot of pressure on Saudi Arabia. And that's really even when the Senate voted. So there were multiple legislatures, both in Congress and in the Senate, that passed supporting Indian U.S. support for the war on Yemen. Unfortunately, all of them were, vetoed by President Trump. Do I see any hope for, an end to this? I do, actually. And the reason not the Khashoggi's killing, but rather the attack on the oil fields in Saudi Arabia. That was, I think, a watershed time, because the Saudis realized how vulnerable they are. And based on the news that's coming out of Yemen and of Saudi Arabia, the Mohammed bin Salman's brother, Khalid, who is now the defense minister, is in Muscat. I don't know if you guys read about that. And presumably he's discussing with Oman the potential to end the war in Yemen. So I'm hopeful. I'm hopeful. And the Saudis have militarily have actually lost land. So the Yemeni have been able, at least from the military sense, to incur in Saudi land and capture about 500 kilometers of land, Saudi land. And they've also captured about 3,000 Saudi fighters, Saudi and other fighters who are fighting for the Saudis. So militarily, they have shown that they are very weak. And actually, Senator Graham said that they cannot fight themselves out of a paper bag. And they've shown that they are weak militarily. And so the fighting showing them that they're weak, they cannot continue that. And also the attack on the oil fields has, I think, made them realize that they need to sit down and find a way to end this. Also, the Emiratis have decided that they're going to end their participation in the war in Yemen.
Thank you. Alice, I'm curious if your questions around who's making money off this war, is that attached to your previous one? Or is it a separate question?
Yeah.
Okay.
So who's making money? The U.S. companies. There were 37 countries that sold weapons to Saudi Arabia. So those are the people who are making money. Actually, in the last incursion of the Houthis into Saudi Arabia, they captured a lot of tanks and military vehicles. And the Canadian newspapers were talking about how these are Canadian military vehicles and that the Saudis have not paid the price, which was about $1 billion. So yeah, 37 countries are making money out of this. And of course, warlords in Yemen, for sure.
So the floor is open if folks have questions. We do have a comment from Crystal about the ineffectiveness of the UN in preventing violence, not just in Yemen, but in Kashmir and various other places. I have a question if there's, I know that you have the Yemen Foundation, if there's other organizations in the diaspora that folks can support or learn more about Yemen through,
Yeah, so on the CARE USA, a lot, Oxfam, a lot of these groups actually have work in Yemen, and they've produced beautiful material on the situation in Yemen. So UNICEF definitely has a lot on that. So I use a lot of the material from, as I said, from UN sources, because I want at least the information to be accurate. Because if and because of how I feel about this, I don't want to be overly, called biased. So that is something that I'm very careful with. Yeah, but Oxfam and CARE, and I've actually contacted many of these organizations here in the US.
Thank you.
Mm-hmm.
Beth has a question about the impact I think this is the impact of displacement of Yemenis internally and outside of Yemen.
So unfortunately, because of the blockade on Yemen, not many people are able to leave Yemen to be refugees. And then the other thing, which is really also heartbreaking, is the Saudis have managed to make sure that the Yemenis are not called refugees if they leave Yemen. Because if you're called refugees, then you get a lot of rights, and you also increase the visibility of the cause. So Yemenis outside Yemen are not called refugees and not given the refugee status. Within Yemen, there are about over 3 million internally displaced people. We don't have a lot of camps in Yemen because culturally, people host those who are displaced. So what happens is you have a family that has 6 now hosting 10 families or 5 other families. And so instead of feeding 6, now they're having to feed, 80 or 60 people. And this is cultural. people feel that they have to host people who are displaced. So we don't see a lot of pictures of camps like you see like in from Syrian refugees in Jordan, or you see them in Lebanon, or even in Turkey. A lot of the Yemenis are absorbed with other family, either family or not just even family, but even friends or even strangers who know that you don't have a place to go, so they will offer you to stay with them. There was an April Ali wrote a paper on that, which I was actually impressed because I knew that, but to have someone write about it was good to see.
Yeah.
I just also want to say that my email actually should say org, not .com.
Okay.
Just so used to writing .com and everything else. But if they want to contact me, I'm happy to talk to them or answer any questions they may have.
Great. So I have a couple more questions. Granite's asking if there's any popular solidarity partners that we should know about. So not just organizations that work on direct aid, but
right.
Political.
There are a great group of people that I work with as well. I'll send you a list. And there is Action Corps New York. They've been excellent at working with us. I don't know if you know Isaac. He's just a fireball. He's done. Single-handedly. We have also a Yemeni group in Yemen Alliance in the Bay Area.
We have someone in the chat who knows Isaac. Elisa knows Isaac.
Okay, probably him. He's from New York. And then Jihan and her group, Yemen Alliance in the Bay Area. Oxfam is actually another group that we work with. We work very closely together here in Washington. And when I go to DC, I don't know if you know Freedom Forward, Sanjeev Berry. Sanjeev is extremely active in that. There are quite a few people that we work with on the advocacy. And of course, the Friends have been wonderful. I was in DC last week and met with Kate Gould. She's no longer with the Friends, but Hassan now, At-Tayyib took her job. She's now with Representative Ro-Khanna. Kate Kaiser, Win Without Word, is someone who has been amazing. And I've invited her to come to speak at the conference that I organized here, the University of Washington. So there are a lot of people. Just Foreign Policy is another group that we're working with as well.
Thank you. And we will send out this to the people who registered, and if you have other resources that you want to share with folks, we will add that as well. And we probably have time for like one more question. If anybody has anything, put it in the chat. Pat is asking if there's good human aid organizations to donate to that you recommend.
I hope they donate to us, Yemen Relief.
Great, yes.
That. I want to say also that we are actually 100% volunteers. 100% of our funds go to help in Yemen. We finally were able to actually hire one person in Yemen who is our program manager, and that is through a project from the Canadian. We got funding from the Canadian Grant Challenge through a proposal, and we put their funding to hire a program manager in Yemen. But the country director, the office that we're in Yemen, all of that is volunteer, and all the people that work with us in the governance are volunteers. And here we're all volunteers as well.
Okay. And Granite, with our final question, which is there any alliance or work with Palestine solidarity organizations like JVP?
We haven't worked with them because I think we have a lot on our plate, and I'm sure they have a lot on their plate. But when I spoke in Atlanta in September, it was through Fahd Abu Aql. He's the one who invited me to speak.
Wonderful.
Yeah.
Thank you so much for being here with us. I know I learned a lot. I think we all learned a lot about this issue. And yeah, I'm just so grateful for all the work that you're doing. Thank you so much.
Thank you. Thank you very much, all of you, for attending and for giving me a chance to speak to you today. And again, please contact me if you have any questions.
Okay. Thank you.
Thank
And
you.
thanks, everyone.